COVID hospital admissions are once again on the rise. And for the week ending on July 29th, just over 9,000 Americans were in the hospital with the virus.
Yeah, so that's an increase of about 12% from the previous week. But this uptick, it's a little different than the previous 3 summers. And joining us now live to talk more about it is Dr. Amisha Dalja at Johns Hopkins Center for Health Security. Doctor, thank you so much for joining us. So the slight uptick in hospitalizations are happening as the CDC at the same time they released new data about this new COVID Omicron variant, EG.5. Should people be concerned?
I think that people need to recognize that COVID-19 is here to stay, that we're always going to have ups and downs. And if you're in a high-risk group, you need to be careful or cognizant of the fact that you could get infected and it could be severe. But for the vast majority of people, this is a mild illness and not something that is of the same caliber that it once was, because there's so much immunity in the population, and we have tools like Paxlovid to keep people out of the hospital. So I think this is par for the course and what we're going to expect in the years to come.
And students are getting ready for back to school. Doctor, what should they know in terms of the parents? What should they know, especially for the fall coming up?
Well, we expect that with people interacting, and as it gets colder, COVID-19 will also accelerate. But this is a different COVID-19 in the sense that there's so much immunity in the population from vaccines and boosters and infections and combinations of all of those three that we've really decoupled serious illness from cases. And COVID is now a much, much more manageable infection, very much like many of the respiratory viruses we deal with year in and year out. And it's not something that I think we need to panic, but we're always going to have new variants, and we're always going to see this virus evolve to be able to reinfect us just like other respiratory viruses do.
And it's comforting to know that this is all much more manageable. Can you talk about the different COVID-19 vaccines?
Well, we have 3 vaccines available in the United States. We have the Moderna and Pfizer mRNA vaccines, and we also have the Novavax protein-based vaccines. Those all should be undergoing an update, and we likely will have an updated booster vaccine that targets the Omicron variants better, more the ones that are circulating now than the ones that are in the past. And that should be available in the fall. And I think that will be important, especially for high-risk people, to take advantage of that booster vaccination. But I think what we're seeing is that the booster is likely to be targeted towards those that are high risk, because that's where we're really seeing the residual hospitalizations and deaths occurring, because for younger people now with all that immunity, it's not as serious an infection as it once was.
Very helpful information, Dr. Amisha Dalja. Thank you so much for your time. Really appreciate you.